This is a crisis. We are managing a crisis. We never expected this. And we as the key stakeholders in HIV AIDS prevention, we have to look for a way of how we are going to continue serving our people. Uganda as a country had made a lot of progress in the prevention of HIV/AIDS, but when we got this executive order from the President of the US, it's going to affect the way we have been delivering services, and also that might affect the way it has a big implication on the fight against HIV. I think when we have these other engagements and some other colleagues, NGOs, we shall come up with a way forward. Because the fact is, we should continue the fight as the key stakeholders, and we have to look for funds, wherever they are, so that we can continue serving our people. All of us have been affected or infected by HIV. That one, everybody knows it. I always give an example. When I was in O-level, when HIV had just come in the country, I had a sister. She started getting infections, had so many things. Then the cotton tested her, said she was positive, but she didn't tell her. So we lived with her for some time. We went, there was that lady Nanyonga in Masaka. She wanted to go there. We took her there. She ate the soil. It was a soil, by the way. She never improved and so many things. And at the end of the day, she lost the battle. In fact, the one who looked after me in O-level, when I was in O-level. So I always remember, it's called Asabaluse. So all of us have been affected or infected by HIV. Whether a friend or a relative or an employer or employee, in so many ways. So we have to continue the fight. So the CSOs have come here and the Uganda Aids Commission. We want to hear from you. Let's share the pain. Let's share to see how we can be able to run these activities, how we can be able to serve our people, that we continue the fight. We had a number of engagements as Parliament, not as Parliament, but in a different forums. I've been talking about this. We also presented it on the Parliament as a matter of national importance. When we went for the caucus, we talked about it. So all of us are concerned, but have to come out with a solution. We will forward.
For having us today, and I'm glad you are calling it a crisis. I don't think I've ever seen this number of people coming together like this. So it is indeed a crisis which we are trying to manage. And there are three areas that we want to put emphasis on. We may not go into great detail as you may think because of time, but the first thing that we are going to look at is that what is the implication of the executive order for us, what the waiver, how it's affecting the National HIV Prevention and Control Program, impact on ARVs, ART, lab testing, lab services for viral load, CD4 count, TB testing, and all that to come out. The second area is definitely to do with future funding and support. How are we going to sustain after the executive order? What is crucial? What is important to discuss so that we get a way forward? And then the third area is to do with collaboration, and I'm sure that's why we have UNAIDS here. Thank you, Jackie, for being here with us. TASO, Uganda Cares, and all the people, and NAFOFAN, thank you for being here. I think we are saying the same thing, but we just want to make sure that it is heard. And we want to thank you that even at the I think the caucus, parliamentary caucus, that was said. We want to thank the HIV committee chair also, because she also listened to us. And so at the end of the day, what are our next steps? What are we going to do as Uganda government, as donors, as partners? What about sustainability? how are we going to go on? When we had the stories of what is happening from members living with HIV, it was getting very scary. And you could see further ahead that things are going to go bad. So we want to contain the situation before it goes out of hand.
Executive orders of the President of the United States of America and its effects on the national HIV response in Uganda, that we spend about 1,928 billion shillings each year to deliver all HIV services, all comprehensive HIV services, be it prevention, be it treatment, be it psychosocial support, but also the services relating to training of health workers, delivering of commodities, and so on and so forth. But of this 1.9 trillion, 60% is dedicated to drugs. And this, I estimated it to be about 323 million US dollars, which is equivalent to 1 trillion Uganda shillings. Now, out of this 1 trillion, government of Uganda is putting 230 billion, which is equivalent to 62 million US dollars, which means that the balance of the 1 trillion, if government is putting a quarter, the 3/4 comes from our partners. And of course, the partners include Global Fund, but also the US government and a few other partners like the Clinton Access Foundation. In addition to the contribution to treatment, PEPFAAR has been providing about 340 billion, which is equivalent to about 91 million US dollars for health systems strengthening. And this includes support for human resource. The PEPFAAR has been providing salaries, recruiting and deploying health workers, 4,333 clinical workers. And as you know, clinical workers include doctors, pharmacists, laboratory technologists, nurses, midwives, mental health workers, counselors, and others. But in addition to these 4,300, PEPFAAR has been supporting 16,690 community health workers and lay workers. And these have been deployed across 2,000 health facilities in Uganda. Some of them government, some of them private not-for-profit. And of course, some of them standalone clinics, which are supported by implementing partners of PEPFAAR. These are critical cadre. The community and lay workers are critical because they play the role of linking people from the community to the facility for treatment, but also they are able to follow up health clients who get lost to follow up.
I'm glad that, Mr. Chair, you said it's a crisis. And it's a very big crisis, unprecedented, not even comparable to COVID, because COVID prepared us. They told us 2 weeks, we are closing, prepare, go to the village, and prepare yourself for the lockdown. But this one came on the 24th, the stop work order was issued. On Monday 27, we came to our emails, and they were saying, please stop all work. Whatever has not been spent, prepare to return it on the 31st of January. And that is for those of us who have NGOs, but that is also true for those who are working in NGOs or are expert patients in our public health facilities, because most of the community health workers, the 16,000 we are talking about from this paper from Uganda Aids Commission, are community health workers, expert patients, COP monitors, linkage facilitators, mentor mothers, in the antenatal clinics, they are in the art clinics, they are in the TB wards, they are everywhere. And so for us, it is not just a freeze, it's a trap on our lives, and we see it as a death trap, and it is so tragic because we feel mentally we have been shocked to our marrow, because for the last 22 years we have had antiretroviral treatment flowing naturally going to the labs, getting the viral load tests and all the other TB tests, the HIV tests, coming in very well. But with the freeze, we see a disruption in treatment. That first week, organizations like MJAP, IDI, they called us, come and pick your medication for the next 30 days. So we are all running. Some of us fell with borders because we are running to get our life. This is the second lease of life and it was being threatened. And so we are holding on to the 90 days. On Friday, we had a technical working group of the Ministry of Health, and they were saying they are sure of mama kits until a month at the center. And we also learned that they are also not sure whether the local facilities actually have mama kits, and that has implications. 2 days ago, a mama went to deliver. She's HIV positive, and she was asked to pay for nevirapine. And that is the one who is able to call and say this is happening. In Mkono, PrEP wasn't, so the man said, I'm stopping my relationship with the PLHIV because I don't have PrEP. I cannot continue to expose myself. So I'm trying to show you what is going on in our communities. We do realize that the last year's report of 2023, the new infections were 38,000. But of these, about 9,000 are adolescents and young women. And I want us to juxtapose it with the police annual crime rate report of 2023, where we had deferment of about 14,000. And I think the majority are girls. And so we also, when you divide 38,000 by the 365 days, we have 100 new infections every day. So in the last 14, this is now the 17th, 18th day of the freeze. What's going on when condoms are not being distributed? When people are saying, let us swallow medicine intermittently so that we can save for the 90 days. And Honorable Sarah shared a story. The lady was saying, I will take today, tomorrow I miss so that I'm able to meet the 90 days expectation until we are sure we can get medication. Because if I take it now, what happens after that? We do realize that as of October last year, we had about 55,000 non-suppressed persons, those who are taking treatment but they are not suppressed. And we know these are the most infectious because their viral load is high, and if they are going to have sex or they are baby mothers delivering children, they are likely to transfer the HIV. We also realize that as of 2024, quarter 3, we had 22% lost to follow up. That's about 200,000 in this country. And that's when we had this USAID support and PEPFAAR and CDC happening. So what is going to happen now? And what is happening now? And now we have been told the standalone clinics are going to be closed, to be phased out. And we know, of course, this is a call to action and a cry by the government to say we need to respond to the freeze. But that's not what it should be. We need to have a phased and planned approach. We also do realize that the DICs, the youth centers, the shelters, the safe spaces are going to be closed. And a number of them have been closed because of the freeze. We have adolescent girls and young women. We have key populations people don't want to listen to, but they have the highest rates of HIV in this country. And they mingle with us. And for female sex workers alone, if you look at the USAID documentation, 56% of female sex workers are HIV positive. So if they don't have treatment, PrEP, they don't have ARVs, they don't have condoms, they don't have the DICs where they were picking and getting the social support and protection and whatever it is, what happens? So for us, it's not just a mere freeze, it's a freeze on our lives. They are closing our blood, we are dying slowly, and we are only thinking, our parliament, does it think like us? Does it represent us? Does it know that we are people who vote, that we are the people who are going to vote, that dead people don't vote, that our people, when they are very sick, they will give us calls every day to say, I need medication, my mother is sick, my daughter is sick, I need to be in the hospital. Because for us, a crisis, Mr. Chair, demands that we have a supplementary budget that comes to our community groups, the people living with HIV specifically, the KP groups, the adolescent girls and young women, the DREAMS projects that have been shut down. Those are livelihoods that are ending. Our salaries have been shut down. We cannot sleep because we are thinking, what happens tomorrow? Because right now we have no salary, we have no income. That little money that was coming as expert patients, it's no longer flowing. We can no longer buy the maize by the roadside. We can no longer hire the hotels. We can no longer pay taxes to this government. What happens to the health facilities if there are no taxes? We are in a desperate situation, and we are just thinking if a supplementary budget of about maybe just 2 billion to start off, a task force that helps us to start an emergency task force for Ministry of Health, for AIDS Commission, for our development partners to say, where do we start? How do we start looking for these who have been lost to follow up that are coming? And finally, ladies and gentlemen, we would like to implore you that we start thinking at this as a crisis. The budget process is happening now, and we are looking forward to see how much more our health committee, our HIV committee includes more resources for the health budget so that we are able to meet the systemic challenges and gaps which have been there all this time, but also which are created and worsened by the ESG government. So I want to stop here, but also I hope as we speak, as we cry, we appreciate that it is not as easy as driving the cars coming here, but our communities are in dire pain and they are freezing. The information going there is not even clear. We don't see any programs on TV, radio telling us what's going on.
Okay. Thank you very much, Flavia. So Rubio communication gave us relief. However, it did not. The biggest problem was that even when it was issued, there was no follow-on communication from PEPFAAR Uganda to the implementing partners. And so it did not result into clinics reopening, people being recalled back from office, from unpaid leave. And of course, the patients continued to be called to go and receive their medication. So when you read this, maybe I could read what the Secretary of State wrote of the United States. Implementers of existing life-saving humanitarian assistance programs should continue or resume work if they have stopped, subject to the following directions. The resumption is temporary in nature and except by separate waiver or as required to carry out this waiver, no new contract shall be entered into. For purposes of this waiver, life-saving humanitarian assistance applies to core life-saving medicines, medical services, food, shelter, and subsistence assistance, as well as supplies and reasonable administrative costs as necessary to deliver such assistance. So the interpretation of this could mean, for example, that all the health workers who were supported by PEPFAAR in Uganda come back. But it could also mean that not all, because, for example, there are HIV prevention services that could also be interpreted as infringing on diversity, equity, and inclusivity. So they were waiting for an interpretation of this waiver. I think for me, that's how I can summarize how it affected us.
The other example, Chair, that this waiver, a key prevention component like condoms is not covered. Government of Uganda doesn't fund condoms. Our condoms are fully, Dr. Mugiope, you can clarify, are fully supported by partners. Now, condoms are a key intervention in our prevention strategy. And if they are not being delivered and distributed now, you can see what that means. So that's an example. The other example, Chair, is the hub and spoke that you spoke about, that a lot of the interventions that are prevention, that are to key populations, going out for testing, taking services to key populations like the commercial sex workers, are largely distributed, through community systems. And when you look, again, subject to what extent does this cover that, and we are still gathering information and costing that. so that we can supply additional reports that further quantify and cost what specific services are being impacted.